Okay, well, wonderful. Welcome, ladies and gentlemen, to this session in the What Works Global Summit on Campbell Food Security and Food Systems Platform. This is a relatively new platform that is being created from the existing Campbell Nutrition Platform, and I've had the great pleasure of being the co-chair for this platform for almost a decade now, and I'm very pleased that we now will be passing the mantle of this work to two of our distinguished Campbell leaders, Dr. Annette who's also co-chairing this session with me from the Iowa State University, Department of Veterinary Diagnostics and Production in Animal Medicine, and Dr. Gavin Stewart, who I will introduce very shortly. So our session today is focused on a range of items of global interest that we have had in front of us for a while, and these focus on the entire remit and the evidence growing on the importance of food security and the global platforms related to this. So we have three distinguished speakers, and I shall be introducing them in turn, and they will be speaking specifically to the topics that you see highlighted on the slide in front of you. The topics are related to the platform on food security and food systems. Our very first speaker is soon to be Dr. Bianca Carducci. She's a PhD student at the University of Toronto in nutritional scientists and is a research analyst at the Center for Global Child Health at Sick Kids. She has an expertise in maternal, child, adolescent health and nutrition in low and middle income countries in particular, and she's exploring the links between food environments, food systems, and outcomes in such contexts. And she'll be speaking on the impact of COVID-19 on food security and nutrition. What do we know? She'll be followed by Dr. Betsy Elizabeth Kristjansson. She's a full professor at the Center for Research in Educational and Community Services, School of Psychology, Faculty of Social Sciences at the University of Ottawa. She is a health measurement expert, and her research focuses on the spatial dimensions of health and health inequities, food voice, and food insecurity. Another primary research interest is on systematic reviews of interventions to reduce socioeconomic inequalities in health. And she'll be speaking today on the effectiveness of community-based interventions for addressing food insecurity. And our final speaker, last but not the least, is Dr. Gavin Stewart, who is a senior lecturer in evidence synthesis, and he works across a very wide platform of health, social sciences, and environmental nexus. He is very widely published and referred as a scientist, producing meta-analyses, system models, methods, papers, and he's a passionate advocate of both meta-analyses and open science. And I'm told that he hates p-values and vote counting and thinks it's high time that scientists got their act together to inform policy with useful, coherent research. And Gavin will speak to us today on developing an evidence-based framework for food security. And I've already introduced my co-chair. So after this, I will expect the three speakers to go in sequential order, starting with Bianca Carducci. And she will speak on the impact of COVID-19 on food security and nutrition. What do we know? And at the end of the session, Dr. O'Connor will be leading the discussion and the Q&A session. Thank you very much. Bianca, the floor is yours.
If I could just ask everyone to mute themselves unless they are Bianca.
Perfect. You can see this? Yeah. Okay, so I will be discussing COVID-19 on food security and nutrition, as Dr. Bhutta just mentioned, and sort of what do we know from the literature and what have we sort of seen in other government documents or other great literature sources. So when looking at COVID-19 from a diet and nutrition lens, there are a trilogy of impacts which stem from economics, from food, from health system shocks. Food systems have been unstable from various events and shocks previously, such as the oil crisis in the 70s, the SARS and Ebola outbreaks, and the 2006-2008 food crisis. In particular, in the COVID-19 situation, we saw sudden reverse migration of newly employed folks from urban centers back to rural communities, and that puts existing strains on local food and health systems, as we observed in India. We know that women continue to be disproportionately affected by the COVID-19 pandemic, absorbing shocks from the greatest incline, the greatest drop in labor and income, as well as lower job security in the informal sector, and then greater childcare demands at home. We know that food security, and even in famine situations, these are not associated with physical availability of food, but what matters most is people's access to food. Some of the current income declines are direct consequences of COVID-19, such as working time lost, whereas others are policy responses to reducing the rate of disease transmission. Together, we see that folks have reduced access to food. And we know in LMICs, the folks are not equipped to weather the COVID-19 pandemic. And that's one of the highlights of this pandemic, is that LMICs are susceptible to external shocks, limited financial resources, and they have a weak provision of public services. So together, this trilogy of impacts is sort of what we've been seeing in the literature. With regards to food production, there has been challenges driven by movement restrictions, whether these are national or international, border closures, and changes in the demand from consumers. Only 20% of supply chains in Africa and South Asia operate as they do in North America, for example. So food is provided by small-scale farmers moving through informal markets, and they rely on this complex network. When there are labor shortages, which we've seen here in North America, but as well across the globe, especially seasonal and migrant workers, there are input shortages such as seeds and fertilizers. We see disruptions in food production. As well, the uncertainty about the impact of the pandemic on availability of food has created volatility to food demand. So we saw consumers stockpiling food items such as packaged goods, meats, and dairy products. And this shift then further caused increased food loss as suppliers then struggled to adjust their products in response to sales. And we saw a lot of food waste in the dairy industry, as well as perishables such as fruits and vegetables. With regards to staple food production, there has been relatively little shift in staple food production, whereas labor-intensive activities in some markets and processing activities is where we saw a strong effect. But according to World Bank, most recent estimates on staple foods, the commodity price index for staple foods, although it's stable, it's 25% higher than it was a year ago. In September, maize and wheat prices were about 34% and 6% higher than they were in January 2020. So that will definitely, we will see an effect down the line on consumers. With regards to food supply chains, we noticed within markets, there was closures on formal and informal food vendors in the early stages of the pandemic, and this created the supply shock. Whereas the lack of purchasing power due to unemployment and income losses reduced the demand, and that created the demand shock. Another point of breakdown is the processing, as I mentioned, processing of meat in particular. And we saw this in North America, where the proximity of workers within meat processing plants, there was high rates of disease transmission, and that disrupts the supply chain. As well as, distribution. There was a dramatic reduction in international travel, and then slowdowns in administrative processes that again affect food trade. And we did see in food trade some international restrictions on food products and exports. And in the early stages of the pandemic, we saw approximately 19 countries impose trade restrictions, but those have since been lifted, and that's an important point. With regards to food consumption, the closure of restaurants and other retail service restaurants affected eating and purchasing, as well as the unusual demand from food service to retail, such as grocery stores and supermarkets. We also know that households sought to reduce the impact of income losses on their access to food, and this included reducing meals, substituting meals, or eliminating meals altogether. And all of these strategies lead to very poor quality diets, micronutrient deficiencies, and rises in maternal and child undernutrition and overweight. And that, the latter, the overweight part, is complicated by reduced physical activity, confinement strategies due to unemployment or lockdowns. So this was one of the first studies that did come out regarding dietary patterns in the first wave. This was completed in Italy, actually. And through their survey, they noticed that consumption of delivery food, packaged foods, sweets, bread products, there was an increased intake, whereas fresh fish or fresh dairy products, fruits and vegetables, there was not a similar increased intake of those products. And that's something to note. As well as coping mechanisms. This study was conducted in 3 countries, and coping mechanisms such as whether or not there was a reduced supply of food due to perceived risk of exposure to COVID-19, whether that was in immediate family or relatives. So in Bangladesh, households who perceived that there was a risk of COVID-19 in their network were more likely to be reported as food insecure. And these households were more likely to report acquiring a loan or using savings to access food. In Nigeria, the opposite sort of happened. Households were less likely to report a threat of COVID-19. But if there was a perceived threat, they were more inclined to job loss or business closures. And then finally in Kenya, male and female respondents were more likely to also report business closures. But in vulnerable households, reporting to have reduced food consumption, it's possible that they also used food assistance to compensate for their loss in income or business closure as well. With regards to global inequities, although the dominant narrative declares that urban households are suffering the greatest loss of disruption of food systems, we cannot overlook also the overwhelming rural phenomenon that we have seen typically. There's also been documented gender and racial inequities of food insecurity, and there's been many studies out of the United States on this. So I think we will see more and more in the coming months after sort of this 4th wave, and that will be some interesting data to look at. So one exception to this theory, this study was out of Latin America of 1.3 million participants who completed a survey over Facebook. The opposite was seen, where living in a rural area or village, we saw a higher prevalence of food insecurity. Those who identified as female, and likewise those having COVID-19 symptoms or those afraid of being seriously ill or a family member, were at a higher prevalence of food insecurity. In response to this, the expansion of social protection programs have been an important element in the response. About half of social assistance measures were cash-based, most of them being short-term in duration. In developing countries, the size and duration of such responses seems to be highly variable. We also don't really know the precise allocation across households, so were these given to just mothers, for example. We can see here between March 20th, 2020 and May 14th, 2021, A total of 3,333 social protection measures have been planned or implemented in over 200 countries. This represents almost a 150% increase since December 2020. With regards to essential nutrition interventions, we saw early on in the pandemic, the demand for health facility and community health services plummeted in several countries due to virus transmission concerns, travel restrictions, and income losses. We saw reductions in community health worker visits, disrupted screening and management of acute malnutrition, and this ultimately led to lower coverage of nutrition counseling interventions, as well as provision of supplementation, immunization programs. Our group at Sick Kids is actually conducting this research on South Asia. It's unpublished data at the moment, but we see that there is an initial decline in coverage in Q1 and Q2 of 2020, and then a period of recovery in Q3 and Q4 and Q1 of 2021. But several services still remain below pre-pandemic levels. And then again, we see in Q2 of 2021, again, we see another drop in coverage. And this corresponds to the Delta variant surge in India and South Asia. So it's important to remember this pandemic is not over. With regards to school meal programs, we know that early in the pandemic, school closures not only affected the distribution of school meals, but also other school health services and physical activity, which all impact nutrition and food security. Suspected short-term and long-term consequences of these behavioral changes can range from overweight to other mental health issues, and a lot of this needs further investigation. So this is the current situation. There's still 37 countries with school closures, and obviously many children that are still missing out on school meals. I think we also need to keep in mind now that schools are reopening in many countries, school transmission is something we need to keep top of mind, and how this may affect our food security and nutrition moving forward. So some recommendations, our group at Sick Kids, along with colleagues at IFPRI and GAIN, published a comment paper in Nature Food back in February. And we put out some recommendations ahead of the Food System Summit, sort of what we foresee, how to make food systems more effective, inclusive, resilient, and nutritious for all populations. And so, given the suspected origins of COVID-19, we need to strengthen international food market transparency and monitor food movement in real time and ensure that decision-making is data-driven. This will ensure compliance, food safety, food supply, and food prices, so food is not going to waste, and we can meet the demand of consumers. As well, we need to invest in effective behavioral change in nutrition. We need to invest in national community agriculture programs to promote nutrient-dense staples and nutritious foods. And then finally, the flow of nutritious foods through social protection systems must be increased. For example, we need to link cash transfers to behavioral change to promote the consumption of nutritious foods using vouchers or cash in markets for nutritious foods. We also need to promote social protection mechanisms such as, skill transfer and business training for women to grow their businesses, and that will provide an additional boost to food security and nutrition in the long term. So I'll stop there. Thank you very much. And I'll hand it over to Betsy, I believe.
Just going to wait and see if there are any questions or anything in the chat. I don't see any, so Betsy, I think we can hand over to you.
Okay.
Sorry, I was on mute. Thank you very much for that presentation. It was wonderful.
Okay, are we ready?
You are on, you're not on full screen share?
Yes, I am on full screen now. Thank you.
No, you're not.
What? I'm not?
Could you go up to display and just We can see your notes. There we go. And I think you're going to swap there. Yep.
Okay, fantastic.
There we
Okay.
go. Thanks very much.
Okay, well, today I'm going to talk about an incredibly complex review that has turned out to be much more than we ever expected. It's community level interventions to increase food security. And I'm here representing 15 authors. We are nutritionists, we are systematic review experts, students who are become food security experts, and a statistician, and people like Vivian who really know their systematic reviews. Okay. Now we had two objectives. One, we wanted to systematically review the effects of community level interventions in improving food security in high income countries, both across whole communities and for disadvantaged or at risk people or groups within a community. And we also wanted to understand the reach and uptake for each intervention. Okay, now here's our conceptual model. I won't go all through it, but at the top you see there are included interventions. And this gives a picture of the interventions that we included and reported on. There are interventions to improve the availability of food, like those to limit food deserts and healthy corner stores. There are interventions to improve access and availability, like home delivered meals, mobile fruit and vegetable markets, and food recovery programs. There are also interventions to improve the access to food. We are interested in social policies, social interventions to increase knowledge or skills that also include a financial component, and discounts on fruits and vegetables. Now they have impacts on immediate outcomes, and then the immediate outcomes affect the primary outcomes. But all along, we have to consider the context in which these interventions occurred. The political and organizational context, the economic circumstances in the country or region, community assets and demands, and geography and weather, and culture, value and preference, and socio-demographic factors. So we have to include that. So the other thing to point out is that interventions had to be measured longitudinally. We were interested in the difference between experimental and control groups and the change in outcomes. We were interested in change, as you can see. We did make an exception for women, infants, and children and birth weight, because obviously birth weight can't be longitudinal. And interventions had to last at least 3 months from baseline to end of study. We felt that this was probably the minimum time in which ecological level intervention could make changes. Now, the outcomes we are interested in. We are interested in change in food security level, dietary changes, changes in the capacity to budget for, acquire a nutritious food, changes in physical health, changes in mental health and well-being, and adverse outcomes we considered stigmatization and obesity. Now, what we weren't interested in is nutrition education interventions, individual level interventions without an ecological component. Okay, so again, on the inclusion-exclusion criteria, we included RCTs, cluster RCTs, and stepped wedge RCTs. We also included many versions of a non-randomized studies with control group, such as control before and after, historical cohort, and interrupted time series. The types of participants, people of any age from high-income countries, and this was limited to high-income countries. A friend of mine has done a review for lower and middle-income countries. And we are especially interested in people living on low income or in a socioeconomically disadvantaged area. Searches were pretty darn thorough, and you will see this when you see the number of studies we came up with. We searched in 13 databases, and we studied the reference lists of included studies and reviews, And we also contacted experts, and I did find a few papers by that. So if someone was an expert in supplemental nutrition assistance program, I contacted them and said, am I missing any studies? Now the results. We screened 42,000 records. We had 50,000, but then the duplicates were taken out. And we read 678 full text. Okay, so the included studies, we included 56 studies and 14 interventions after all of that reading and screening. And the interventions to improve economic access to food the results were for Supplemental Nutrition Assistance Program, SNAP, and we had 8 included studies. And we also had the Special Supplemental Nutrition Assistance Program, which is meant for pregnant women and women with very young children. And 8 of those are included. We included 1 study on a healthy baby benefit in Canada. And there were also 3 studies on what was nationally mandated demonstration project to end child hunger. And the most studies were on fruit and vegetable discounts. So someone gets a voucher from the grocery store or from the researchers for like, I think it's 10 to 50% off of their fruits and vegetables at the cash. And so there were 15 included studies of these, and they were mostly RCTs. Okay, now we had also interventions to improve both economic access to food and geographical availability. They comprised home-delivered meals, mobile produce markets, novel food pantry, Nutrition North, and meals to motel shelters. Now you can see one of our issues with this review is that some interventions only had 1 study, and that was kind of frustrating. And there were also interventions to improve geographical access to food. There were grocery stores and food deserts, healthy small grocery stores, food hubs, and community-supported agriculture. And that meant they gave a CSA basket to participants for 1 year, and then they also gave control participants the same amount of money, the equivalent amount of money. Okay, now I thought I would just show you a few forest plots, and I hope you're all familiar with them. This is birth weight and the Supplemental Nutrition Assistance Program. And we only included people who are on WIC since the first trimester, so we could have that 3 months period. And so Devaney, Joyce, Kennedy, and Stockbauer. The average weight increase was 47.8 or 48 ounces, grams. Okay, and then for the Supplemental Nutrition Assistance Program in particular, we had many studies that we had to synthesize narratively, because all the studies are different in some ways, and the outcomes were measured differently. So we had one on food security for households with children under 18, and we both found that both incidence of low food security and very low food security, and the risk of becoming food insecure, was lower, but the risk of remaining food secure was higher. Okay, and also we found the risk of longitudinal household food insecurity for all households. We found 2 studies about that, and the relative risk was with SNAP, so 1.27. So this is probably due to several factors. that the populations are self they chose their intervention, and also to the fact that many people on SNAP are the very poorest of the poor. And so, and some of the analysis controlled for a lot of confounders, but I think they might not have controlled for enough. And then there was no impact on women who are overweight. And there was a change in the rate, a slowing down of the rate of growth in Medicaid admissions once they had SNAP for a year. Okay, now this is the food vouchers. So as I said, food vouchers are given to participants and none to controls, and they redeem these food vouchers at the time of purchase. So if they purchase 10 pounds of fruit and $10 worth of fruit and vegetables, they would get $5 back or something like that. Okay, and here we've had 4 very nice RCTs. And this is the difference in purchase between experimental and control. So the experimental and control difference was 469.85 grams. So a fair amount. Now, as you can see, we had pretty high heterogeneity. So we did do a subgroup analysis. And we compared higher discounts versus lower discounts. The only problem was that the higher discount studies were fairly small. We only had 71 people in total, and they were less of lower quality. But they found that 1403 grams was the increase in food purchase. And the lower discounts reported a 520.53 increase in purchase. And finally, there was one study in which there was done in rural Maine, in which there was a 50% discount, but they were limited to a total of $10 a day. And the other thing is the discount was not given at the cash, but a coupon was given for the next time. So they found a fairly low increase in grams purchased of fruit and vegetables. Okay, and that is it.
Thank you very much, Betsy. I'll just wait for a second and ask any questions. I do have one, if I may.
Yes.
Just quickly, we will take questions at the end. What's the units for the grams increase? Is it month, week?
Oh, that's a good, it's per week. I
Thank
forgot
you.
to say that.
I
Yes,
assumed
it
as
is
much,
per week.
but I just wanted to check.
Yes.
Excellent.
And I forgot to mention that the change in consumption was only 2 servings a week. So there was a lot of increase in purchase and 2 servings per week increase. And I needed a nutritionist to tell me whether that's meaningful or not.
Excellent. Thank you very much. Okay, well, I think we'll head over to Gavin Stewart if we can now. Thank you very much.
Mm-hmm.
We might need you to stop sharing, Betsy.
Yes, I am stopped sharing. Okay, there, I have done it.
Thank you very much. Gavin. And while we're waiting for Gavin to upload his, if any, at the end, we will have a discussion time. So if there are any participants who'd like to ask questions about particular projects or the topic in general, please feel free to drop those into the panel Q&A or the panel chat, whichever you're more comfortable with. Hi, Gavin. Are you having issues sharing? I think so. Just hang on a second. Or ponder the implication of the results of the two studies we've already seen while we wait.
If it won't work,
Yeah,
I've got Gavin's slides. I can find them if you want. Okay.
Yeah, I've got a
I'm
thumbs
going to look for it.
thanks, Vivian.
Just let me find them and open.
Luckily, we've all been doing this for 18 months, so all of us have been here and had this happen, so nobody's worried about it.
Luckily.
Yep. 18 months ago, we might have thought it was different, but now we're like, yeah, we can roll with this punch.
Okay, here I found the slide deck, so then I just have to open it and get going.
We have someone from IT here as well.
Hello. Yes. Hello,
We
Annette.
have appear to have lost Gavin altogether. Hang on, we've lost our speaker, so just hang on a second. I think Gavin had internet issues with on his end.
Yeah, I can see your PPT on a screen.
Yeah, unfortunately, that's not the speaker, and the speaker just actually dropped off. But I think it won't take him long to come back in.
It happened once before.
Yeah, let's see if he has completely lost internet or just accidentally pressed the wrong button. While we're waiting, I don't know, Betsy, if you're still there. I was going to ask, did you use any automated approaches to screening the 42,000 plus abstracts?
The answer is no, but we wish we had. We use Covidence, and the first search we used manage your software, EndNote.
Right. Oh, okay. Right. But you did use systematic review management software, but not any AI approaches.
Not any AI approaches. Yes.
Yeah, and we also already have a vote for Gavin's first slide. I agree. I think it is fantastic.
Mm-hmm.
I like it very much.
Just
Chiara.
one announcement. Gavin, you are in attendees session, so you have to click on share audio video again to join the stage.
Gavin is in, but not as a moderator. Is that what you're saying?
Yeah, that's what I'm saying. He's here. He's in attendees list, but he need to click on share audio video so he can join the stage back.
Yeah, it's like a blue button at the top right that says share audio and video.
I'm going to send him a note saying, just checking, can he hear us? I'm not getting a reply for him that he can hear us.
Okay, we could try in the chat. It just sounds like he is in the session, but he's got to click. Yes, he can hear, but he can't communicate. Okay, but Gavin, do you see in the top right of the screen a little blue button that says share audio and video? That will let you, if you click that and then you go through sharing your mic and your video, then I think the tech people can let you into the. There you are.
There we go.
We got
Can you
you.
hear me?
Yeah. we
Yep.
hear
Great.
you.
Apologies for the complete total chaos and comms meltdown.
No, like I said, we've
Brilliant.
been doing this for 18 months. Doesn't worry us anymore. Seriously.
Okie doke. I'll whiz through these slides and then we can get onto the questions and so on. So this
Now-
is that okay?
Did you want to try and share yours? I think we're looking at Vivian's screen. Did you want to try and share yours so you can progress, or you're happy with what we've got?
I'm happy with what we've got. Let's not break it.
Okay.
Yeah,
Okay.
if
Handing
you're
over to
all
you then.
happy. Okie doke. Next slide, please, Vivian, if everyone's happy. Thanks very much. So I'm going to assume that the folk on this call know about evidence synthesis and don't know about food security. And if I'm wrong about that, we'll sort it out in the Q&A afterwards. So I wanted just to define food security using the World Food Security definition from the UN, which is meaning that all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their food preferences and dietary needs for an active and healthy life. And that's a heck of a mouthful, isn't it? And you can see here some of the frameworks that are linked to the conceptual framework that Betsy was presenting previously in her review, where you kind of got these pillars of food security, where you need availability to food, access to food, and you need to be able to utilize it, and you have to have some kind of resilience and stability in your food supply in order to be considered food secure. And the amazing thing for me about this is the breadth of that definition. It's absolutely staggering. Think about all the different scientific domains that you would need to think about if you were going to try and kind of make sure that you had all of those bases covered, and the thousands of potential interventions that are in there and that fit under that umbrella. So it's incredibly complex, but if you simplify it, it doesn't work. If you miss any of those bits out, there's no point, it doesn't work. So even thinking about food security, straight away you're in this kind of complex, multifaceted world with lots of outcomes and lots of dependencies. And that's a big challenge for us in evidence synthesis world. Next slide, please. And it gets even worse, because that complexity becomes even more intractable when you start thinking about the linkages to broader sustainable development goals. So, in fact, from a systems perspective, food security is probably one of the things that really links the SDGs well, and they're meant to be indivisible. This image on the left is from a paper looking at the indivisibility of the goals in terms of which targets impact on which other targets. But you know, food is perhaps the most central thing that links all of these different SDGs, except arguably for reduced inequality or peace and justice. Because if you don't have equality and you don't have peace and justice, you can't do very much in the world. And we'll talk a little more about some of the links between food security, poverty, biodiversity loss, and climate change. Next slide, please, Vivian. And this creates this big challenge for science and for coherent policy making. And the central point I'm trying to make is that we've got a big problem. You've got this huge tangled ball of wool, and you know, you pull on one of those strings, and what's going to happen? You know, do you pull hard enough to get the string out, or do you pull too hard and turn it all into a great big net, great big horrible knot, or do you pull it too gently to do anything? Because everything is interacting. And even if you kind of just look at one of those threads, then if you turn on a policy and you switch on a whole set of interventions, how do you know that you're not missing a critical set of interventions somewhere else in the chain? And that's before we even start worrying about how we know the interventions are effective, or all of the contextual information and the heterogeneity that you saw in the previous two talks. Next slide, please. So this is where I start thinking about some of the linkages across the SDGs to zero hunger. And one of the fundamental cross linkages is poverty. And in very coarse terms, you can think about alleviating poverty and food security with different strategies that represent ends of a continuum. And one of those continuums would be to think about global markets and agri-tech. And you're trying to develop the economies of scale, and you're increasing productivity, you know, using your GM, and chucking lots of fertilizer about, very high input systems. And people have been pursuing that basically to try and get cheaper food. That's what they're trying to do with that strategy. And in theory, that should lift people out of poverty. But of course, that very process is very market driven, and so it can actually drive people deeper into poverty. And it also has all sorts of detrimental impacts on biodiversity and on climate change, and they feed back into having detrimental effects on yield. So it's not straightforward. And at the other end of that continuum, you can think about subsistence agriculture, and we've got quite good evidence that supporting subsistence agriculture can sustain livelihoods. But again, if you look at the land clearance associated with that, or the increase in inputs, you teach people about irrigation, you teach people about using nitrogen with farmer field schools, for example, which is a Campbell review, then again, you're going to have these knock-on deleterious effects on biodiversity and climate change. You're going to end up with this horrible negative feedback loop. So it's really tricky, non-trivial area to think about. And of course, there are economists and social scientists who spend their entire lives just working on these problems and consider them intractable, wicked problems in their own right. And we're not going to get anywhere with food security unless, well, we've still got loads of people living on $3 a day and not having access to clean water. So a big issue for us. Next slide. So another set of interactions revolve around biodiversity loss and climate change. And basically, if we want more food production, then we need more land or more inputs. And if you use more land, then you're going to end up with biodiversity loss. This figure on the left-hand side is the estimated species loss due to habitat destruction in different bits of the world from the Living Planet Index. And that biodiversity loss is also going to have climate impacts, particularly if we're losing tropical forest and trees, or if we're losing peatlands because of our sequestration of carbon. So then we get a direct climate impact as well. And we also have the impacts on other ecosystem services like pollination services or the ability to provision with water. And all of those can have knock-on effects on food security and lower yields. So pretty much everything you look at as a kind of big solution ends up being a problem somewhere else in this system. It's a bit of a depressing picture. So to cheer you up, let's talk about the scientific evidence that underpins this. Next slide. And I'm afraid I'm joking, because I can't really cheer you up when we look at this evidence, okay? Massive research effort, huge amount of research going on across these domains and disciplines. But the problem is it's characterized by research waste, because we can't stick this evidence together in any kind of coherent, meaningful way. So the different domains have all got different norms. There's no framework for integrating and thinking about how these things relate one to the other. We've got no coherent information on the effectiveness of the interventions. As you saw in Betsy's talk, a lot of the time you're lucky to find one study, let alone multiple studies. Where we do have evidence synthesis, it's fragmentary and of variable quality. There are some very, very good evidence synthesis products available out there on some of these things. And in other bits, there are entire domains of science where they haven't even heard of systematic review and meta-analysis at all. They don't even know what they are. And this has given us this very fractured science policy pipeline. So it's a case of the emperor not wearing any clothes. People are convincing themselves that we're doing okay and that science is informing policy in this space. But where it is, it's usually doing it pretty badly. And that's the problem that we're trying to address. Next slide. So yeah, we're trying to bring together all of these different bits to look at these kinds of food security issues, as you've seen in the previous two talks. Next slide. And the kind of challenges that we're trying to address are thinking about systems models to identify the interlinkages between these domains, trying to develop some commonality of approach with regard to replication and open science and evidence synthesis across all these different domains, identification of the priority areas for review, accepting that some of these, if we want to parameterize these kinds of systems models, we're going to need to use rapid review as well as full systematic review. But we need to be careful about maintaining quality and the integrity of our products. We need lots more systematic review and meta-analysis. We need reporting standards, core common outcomes in the primary research fields. And we need things like value of information and some methods development in order to kind of sort this lot out. So that's the kind of challenge before us. Next slide. And this is to try and kind of, it's making the same point really as the previous slide, but it's to try and show how there are different entry points into this nexus, I think, for engaging. At the top, we need policymakers and practitioners to engage, and we need to develop the systems understanding. And then in the middle, we need evidence synthesis folks to engage. We need to massively increase capacity. We need to develop these norms and the methods, and we need to train people who work in these disciplines in how to do evidence synthesis well. And then among the primary scientists, we need to get them to start talking about core common outcomes, not just the kind of specific to the domain, but thinking about what's the set of things that we're going to measure to look at the interlinkages across studies. Much more adherence to reporting standards, across all of these areas. You get studies where people don't report variances and sample sizes. It's just terrible, the reporting standards. And invariably, people don't really think about strength of evidence. We're all kind of on this pathway to impact, publish in Nature or perish type paradigm. So we really need to get people thinking about, how does my evidence contribute to the existing evidence base? And what does it change? What does it tell us? What does it add? Thinking about how it all fits together. So there's quite a lot of education to do among the primary research community. And my last slide is really just saying, if any of you are interested in this, then please do get in touch, because we'd like involvement. We want to take this places. Thanks very much. Thanks for looking after me slides, Vivian. Brilliant.
Gavin, thank you very much. I want to thank all the speakers very much. They were great presentations. I think they did a fantastic job of looking at the scope, the width and breadth of the topics that we're interested in, and I think that this that the community feels is critical. And I would open it up to the chat or questions now. So I've got someone there who's asking us to vote for your favourite poster, which is true. Please go in and have a look at the posters booth and vote for those. Are there any questions that members of the audience have for the panelists or other members of the group? Certainly welcome those. As Gavin said, I'm more optimistic than Gavin. I do feel we have challenges, but I do feel we have made enormous progress from a couple of years ago, and it's an exciting area to work in.
So, Annette, I have a question of Gavin's, if I may, just to get discussion. So, Gavin, the agenda on what needs to be done in terms of climate change and biodiversity on nutrition, food security is enormous. But let's say if you were given the platform for 2 minutes in Glasgow very soon to say, what are the 3 things that people can do within their sphere of influence that would make a difference in this space? What are those 3 practical things that we, ordinary academics and civil society members, can do? You're muted, Gavin. Even if you're saying something, you're muted.
Gavin, you're muted.
Can someone unmute Gavin?
Let me see if I can.
Use sign language.
I can't seem to unmute, but Gavin, do you not see the microphone at the bottom of the screen with a red bar? No, it's not working. It's not working.
I'm glad I didn't ask this question earlier in the session.
So can I try answering it from my perspective while
Yes,
Gavin
Annette,
tries
please.
to get his answer? So, my answer would be conduct high quality research that answers an important question that you can justify, and report it in a way that somebody will be able to use it to its maximum advantage. I don't feel I can tell someone what is the research question they have to ask in the area of food security, because there are so many, and it's cultural, what will be funded where you are and what your community needs from you. But universally, we need studies that are well executed, you know, regardless of whether it's an RCT or an observational study. I mean, I have a preference for particular designs, but if you can't do an RCT, then do an observational study well, right? Make sure it validly fills a gap or replicates something that needs to be replicated, so it has a real purpose, and make sure you make it available to the largest extent so it can be reused and doesn't have to be repeated unnecessarily. And I think that would be my answer if I had at Glasgow.
It's a good answer. I mean, these are tangibles that people can do. Increasingly, people are asking about what is it that is within our grasp, even if it's making our own institutions green or promoting things within our own neighborhoods. So it's a kind of question that we are being asked increasingly to translate these big global mandates or programs into actions that are more within our grasp. Thank you.
Yeah. Did others want to comment on that? I just feel I can't dictate what the question should be, but the methodology, I think I can come at a global answer for that one. Gavin's going to drop out. Howard says, can you say more about how the group engages with decision makers?
It's a great question, how the group plans to engage with decision makers building on what you have. I see that Gavin is now not muted anymore.
Gavin, did you want to answer the first question?
Can you hear me first?
Yes.
Yeah.
You can hear, right? Yeah, I mean, I would agree wholeheartedly with everything you said, Annette. But then I would add a fourth thing to that. And my fourth thing, if I could do anything, would be I'd do a rapid review to try and find out what things have the biggest effects. And it doesn't need to be fantastic and beautiful and lovely, ticking all the boxes review. It just needs to be something rough and ready that says these are the kinds of uncertainties and these are the kinds of effects, and this is the kind of cost effectiveness of different potential options. Some of it could even be kind of horizon scanning, scoping-y type stuff. But we need something like that at a top level, kind of say, this is where we need to be focusing the attention. Try and guess at what the winners are going to be, what the possible winners are going to be.
Would anyone like to discuss how the group intends to engage with decision makers going forward or in the past? Do you want to have a go?
Yeah, I've not got any kind of a vision for that beyond trying to start getting the science sorted out a little bit and then being able to say, this is what we're in a position to offer. And again, the kind of things that I would love to see would, as a policymaker, would be lists of the possible interventions. What are the possible solutions to all of these issues in different contexts? So the kind of stuff that Betsy had, expanded and fully contextualized. And again, it doesn't all need to be beautiful evidence synthesis. Some of it could just be case studies or case reports of things that have possibly worked. But at the moment, you look at this complexity and it's overwhelming. And so I think developing lists of the interventions and what are the things that we can do, and then starting to appraise them, that's the way forwards. And asking the policy community to engage in that space is probably where we should go. But that's just my ideas.
I would, in our area, I think we've made some progress in communicating with policymakers, especially with respect to the European Food Safety Authority, who's already adopted systematic reviews and are quite progressive when it comes to evidence synthesis. In the US, not so much, but we do have Codex Alimentarius, which has done a lot of work with respect to systematic reviews in food safety. That's a really well-recognized body. There is a lot of work to do when Gavin talks about systems models. I kind of think risk assessment. I don't know whether they have to be separated or they're the same sort of thing. We could probably navel gaze about that for a really long time, but improving appropriate risk assessment, research synthesis and parameterization into risk assessment at Codex Alimentarius would really work, be impactful. So I think there are some areas that we have seen progress in my sort of area of the food and feed area. I'm less aware of the nutrition human side. But that's where the evidence synthesis and the research synthesis community is currently meeting decision makers at the moment to try to get these ideas up and going from the food production supply side.
Yeah, I think the economics components are some of the hardest bits, and the poverty reduction stuff. And the interactions there are really hard, and then again, some of the kind of biodiversity stuff is horrendous. If you get a load of, they're worse than us statisticians, ecologists. If you get a load of them in a room together and say, how do you measure biodiversity? You get, more answers than there are people in the room.
There is a question here from, I'm sure, Hernan. I'm probably going to pronounce the last name incorrectly, and it's a great presentation. What do you think about the role of wildlife in food security? I
was going to say, you're better qualified than me to answer that one, Annette. Go for it.
Actually, we just had this discussion the other day. I mean, I come from a food production background, and I think that wildlife and zoonotic diseases and the diseases of food production, because I come from an animal side, are really important. Of course, I think biodiversity matters an enormous amount in of itself, just has inherent value from a planetary health point of view. But directly for food security, we know that diseases like avian influenza, swine influenza, Nipah virus, those sorts of things have an enormous potential impact on Indigenous groups and their food security. Just even the idea of changing bushmeat consumption and wild food consumption will impact some people's food security without even considering the idea of what would happen if we had a disease that impacted the production of swine, poultry, etc. If we just think about what's happening at the moment with African swine fever and what it has done prior to 2020 in China with respect to food security and the loss of almost half the population. If we were to think about another zoonotic disease that would come from wildlife, that would be important, you know, incredibly important. And we also know that I think it's around about 70% of these diseases are arising from wildlife. So I do think that wildlife has an important direct impact on fertility. We haven't seen a pandemic yet, like this one of COVID, but you know, we were, I think, in the veterinary community, we were expecting avian influenza to be the next big one, right? And then COVID came along, so I was a bit surprised. Goodness only knows what would happen if COVID had affected.
It wouldn't have been good news, that's for sure. Yep. Yeah. And then of course the kind of the other bits, pollination services.
Yep.
You get, you know, and again you get this horrible feedback into food production. You lose your pollinators. Lots of meta-analysis on that. Some of it good, some of it not so good. And other ecosystem services. I mean, water is a biggie. Water and carbon are the other biggies where wildlife is having this mediating effect. Yeah, it's important.
So, Hanan, if you have interest in that area, you know, it definitely fits within this Campbell group as far as we're concerned. Okay, I'm not sure what time the session is supposed to end, Vivian. We don't want to run over.
I think it was 15 minutes ago. So
oh, well, there we go.
I think we're probably done our That's great.
Okay,
a great discussion.
If that said, we should end the meeting and thank everyone for attending and thank our speakers.
Thank you.
Thanks, everybody. Great set of talks. Lovely.
Thank you. Bye-bye.